My anxiety now. I can't walk in if I don't have a mask. I have to run back to my car. If somebody sneezes or coughs, my senses are heightened. It's Dr. Monique Brown. Some of you may know me as Dr. Nick. So today I just wanted to do a COVID talk, right? I have some of friends here. How has COVID affected you in your day-to-day life?
For me, it has impacted my life financially drastically. Also, where family is concerned, it limits your interaction with people because people are standoff about the hugging and the whole, personal, up-close interaction. And my family, I see where it also impact their going about their regular business. A lot of fear is in the air where that is concerned because persons are saying, especially when they go places and there's persons out there not wearing their mask and they're in their space. Work-wise, I've learned to adapt, with the protocols of the Ministry of Health, wearing your mask and sanitizing, which we have been doing for a long time, the whole hand washing thing, but the mask is the new thing,
Right.
But sometimes it can be unbearable to wear it,
right.
Especially when you're into closed spaces and you're in there for a long period of time. But based on what is happening, most people would say it is the new norm.
Yeah, I agree completely. I mean, you touched on some very important points a while ago, the financial aspect. A lot of persons actually were unemployed for a prolonged period, And in Jamaica, a lot of us, probably not me and you, but a lot of our colleagues and our friends and persons in society, they have to work for their own, right? They have to go out. They have to be active, whether it's to sell, it is to do the hustle, the hard work, so forth. A lot of them don't have that luxury of being employed to a sector like both of us. And you touched on the interaction, and I feel as if COVID definitely has dissolved how we interact and how we communicate overall. Because kids can't go to school anymore. They don't know how to speak, interact, play. All those stuff are very fundamental in the development of a child. So, yeah. COVID, please go away. But
well, for me, COVID has really, in some areas of my life, it has really affected me. Even my kids at home, because even the online classes, sometimes they get frustrated because they can't do what they would normally do at school. Sometimes they cry. I didn't know that. I think if you don't have a strong family support system, we lose our children in the sense that emotionally they will become weak, right? Financially, it has taken a toll on all of us. Health-wise, I am very sorry for those persons who actually contract the virus, because the fact that the stigma that is attached to it, right? The stigma and the health factors relate to other persons with the underlying ailments. Not everybody knows exactly how to deal with some stuff. So when they reach at that point in their life, I am really sorry for them. You understand? But it has taught us also how to take precautions and how to properly sanitize and to have proper hygiene. Because at some point in time, there were persons who did not do a lot of hand washing. They didn't do a lot of sanitizing.
Right.
You understand? So
and social distance was
right. So no persons know exactly how to stay in their own space. Yeah. So that's my take on things. Hey, children, sometimes they say, Mommy, I want to go back to school.
Yeah, of course, because
They can't socialize.
they're not accustomed to not having their friends. They cannot see another face. They can't run. The hugging, the interaction that they're accustomed to. I mean, when I was going to school, guys, I'm an introvert by nature, but still, I had people around me. I have a big family, so I'm accustomed to that interaction. People speaking, running, talking, laughing. I can just imagine.
Parties, even a little party at home. You know, all of that has to be taken into consideration. Our children
Birthday
can't do
parties,
that anymore. You have your child now, you have to just have a little cake and put a little candle in it and just let them blow it out. You know, the fun. COVID has robbed us of a lot of things.
A lot of enjoyment.
Yeah, a lot of things.
A lot of my party fans can't go any more parties. I know that for a fact.
Yeah.
My friend behind the camera is saying yes, guys. So definitely. But COVID, we have had to make a lot of adjustments, and I am proud that the society has adapted so quickly. But I think a big thing we forgot to look at is that COVID-19 is depressing. It has, you know, it has really affected a lot of us with that aspect. Or depression, anxiety has kicked up, you know. My anxiety has anxiety now. I can't walk in if I don't have a mask. I have to run back to my car. If somebody sneezes or coughs, you know, my senses are heightened. I know I came a little bit late to the party, but I don't know. You want to give me your 3 cents? Come in, you have 1, 2, 3, 4, 5 for tell me.
Mine, and how it has impacted me.
Definitely.
Alright, so I don't think I go out as much as you do.
As I do. I go to church, sir.
Go to church and work and home.
Church, work, and gym.
We all go to church, work, and gym.
And home.
And home.
You go to gym? You go to gym? Look at me
I
and tell me.
go to gym mentally.
Virtually. Alright.
So I'm like the type of person who goes out once, like when I feel like.
Mm-hmm.
So it kind of really impacted me, this mask thing, having to enter a place with the mask, knowing that especially when you're going in a place that is strictly water, having to wear a mask to go in, to me it does not really make any sense. So I don't really go out like that. But I've learned to adapt. Regular, I'm leaving mask off to turn up go 4 feet. We kind of really tired of that.
Yeah.
It's frustrating. So, as far as it is right now, I am at a point where I can say that I am kind of comfortable, but still want to go back to normalcy.
Definitely. I think a lot of us have been moving toward getting comfortable right now, because I had a discussion with one of my friends, and he said, I think I probably have to strike this from the video. He said COVID has destroyed a lot of families because the husband and wife never spent so much time together before. You know, the wife never have so much interaction with the children before, because they can't go to school. So now she doesn't know how to deal with all of that, and a lot of persons, especially in the inner city community, they're frustrated because it's so many of them in such a small space all at the same time, you know, and then normally they'll be able to go out, probably on the road, probably a dance, a party, none of that is happening again. So social events,
That we know of.
none of that is happening again.
That we know of.
Yeah, and interaction is a big part of society. You know, it kind of help you unwind, release some of your stress levels.
I take my daughter to get an ice cream. I have to design it and take it home, so she don't go anywhere. She don't go anywhere. So I'm wondering what this is going to do to her upbringing, her exposure. Because I mean, you work 9 to 5 job most time. Most of us work hours, certain hours, and you know, when you get the little free time to spend with your kids, especially the minors, them, it's all about, all they see is daycare and home, or online schooling and then it's just mommy, daddy, or mommy, or just daddy. You know, so it limit their resources, it limit their exposure, and from time to time, even my daughter, you can see the frustration. Mommy, I want to go to the supermarket. Mommy, when are we going to the supermarket? Because that is her little out there. You understand? Most times you go out to work and you could just stop by there and just grab a few things and go home. No supermarket.
Right.
You understand? So it frustrating for them to. You know, it is frustrating for them and they act up and then you know don't know how to deal with this with them. They're new.
Right. How do you explain to a child you can't go out because of COVID-19? They don't understand.
They don't understand.
They won't understand. I mean, I think just a couple weeks ago, one of my niece came by. I said, Auntie, I'm tired of this. I want to go to school. And I'm like, I'm not accustomed to kids saying they want to go to school.
They always don't.
Right.
Go to school today.
Yeah, so definitely COVID-19, what a wake up call it was, right?
Yeah.
Definitely is.
But you know, it is a good thing and it is also a bad thing in a way, because it is a good thing that some parents actually get the time to spend with their child. Some parents who are really concerned about the education of their children, they spend time to really sit with them and to look and see what they are doing and actually learn from their children as well. You understand? But for those parents now who are not capable of doing all of that, it is frustrating for them.
Right, and that was a point I was just going to make. For a lot of the parents, yes, it is good because they get to interact with their children more, they can help them in school, they can check the homework. But people who are going to be realistic, there are quite a number of parents that are not able to help their children with their homework. They're not able because they don't understand or because of limits with education, which unfortunately they didn't have the chance. So it does become a problem. And a client of mine said one of the ways he was able to move forward and to do well in school was his mom and dad realized that they weren't able to really help him through high school and read the books and stuff like that. And his dad lived in a different apartment where there was a university student there. And it's the university student that was able to help and kind of go through the work with him. A lot of parents currently don't have that luxury, you know? And a lot of them, because of pride and certain issues, they're not going to ask. And I really feel as if there should be some kind of mentoring program other than teaching the children so that our kids don't get left behind, because I know a lot of children are struggling right now.
A lot are not in school.
Yeah.
Online.
And they don't have access to the
Online.
platforms either.
Right, so definitely something that I think we will want to address some more, find some kind of way, whether it's the churches or the organizations close by, I don't know, but that's something that I'd like them to look into, and Ministry of Education to see if they can kind of adjust that and help a lot more children, reach out to them, you know?
Because I think, you know, you see, after COVID, even though everybody in the world have a level of madness, you know, but we have a whole leap of mad people out there now, because too many persons are being restricted. You understand? And then socially, economically, emotionally, physically, all the alleys combined together. It's not everybody can actually deal with some stuff.
Definitely.
You understand? So when school get back, I hope that in the curriculum they put a section whereby they can do some mental health with the children.
Yes.
You know, and find out where they are at. You know, and even for the teachers, if it's even once per week, try to see if they can interact with the students online to find out how is it that they are coping, and even the parents at home to try to find out from the kids how you're coping. Yeah,
definitely. Mental health and awareness is a big factor that needs to come into play. Sean, give me your take on how you feel
The
corona.
coronavirus it separate a lot of people.
And that's kind of hard for Jamaicans altogether because we used to.
Yeah, we don't use to that lifestyle.
Yeah, we're
We
not
don't use to that
accustomed to it, you
lifestyle,
know.
yeah.
We used to can go the family house so we can sit down and chill. We
Yeah.
can go our friend
Yeah.
house and
True.
you know we can play
Yeah.
Ludo, Domino, and we just chill a little bit. We can't do them things anymore.
Yeah, Christmas gone, it affect everybody.
Everybody.
Everybody worldwide.
Yeah.
Some people never experience a Christmas like that.
Yeah.
This one.
True.
Yeah, that's true.
Yeah.
Because personally, my family, we normally have like this big family dinner. We couldn't really do that because none of we don't want to expose my grandmother, you know? Because, yeah, just in case. Yeah.
Last year was the first time in history I've stayed in my house so much. First time. Usually go out. You know, you have to just adjust and adapt.
And I feel like some people kind of depressed about the whole situation.
Yeah.
Yeah.
So,
Yeah.
as I said, depressed. In my field, there has been an significant increase in suicide, depression, mental illness, and all those things. Like people just can't find ways and means how to deal with it.
Right. They're not coping that
Yeah,
well.
not coping because it affects them livelihood. And you know, sometimes when they used to a certain amount of money, you now make that no more. Yeah, so it affects a lot of people. The box whole pop, as when they say box whole pop, people food, out of them mouth.
So
Yeah.
the persons, lost their jobs and so forth, I mean,
Yeah.
a lot. So we have to just do what we have to do to protect our lives, and spread the word, I mean. So wear your mask and proper hygiene and, keep your social distance. Alright?
Yeah, and eat healthy.
Yeah.
Yeah.
Yeah, that's true. That is true.
Please take your vitamin C,
Yeah, it's true.
It's important. Your vitamins is very important.
Yeah, man, it's
You understand? It's
true.
very, very, very
A
important.
lot of people get fat over this whole quarantine period, you know.
Yeah.
Yeah. Dress up on yourself, big up on yourself. You see, we're gonna shake hands tomorrow, you know. Alright.
Cool.
That's the end of this segment. Any comments? Drop it below. Tag me. Repost, share. If there are any concerns that you want me to address, you can let me know. Thank you guys.